All right, hi, my name is Jason Kistler. I'm the owner of Aligned Chiropractic in Malvern, Pennsylvania. And I'm standing with a patient of mine, Kevin, and we're gonna go through just a little bit about Kevin's story here in the office, what brought him in to see us and some of the results that he's gotten. Kevin's been under spinal decompression for about a month and a half or so and has been seeing some pretty tremendous results. So first, Kevin, if you could just explain what brought you into the office and kind of how that was affecting you.
Absolutely. So we're in November right now, and it was July or even the end of June, and I woke up on a Sunday morning to the point where I couldn't even really turn my head. So I thought it was a stiff neck at first. The next day, the stiff neck went away, but I noticed there was still a significant amount of pain in my chest area, and my finger went numb. So there was a radiating pain through my chest. It was piercing all the way down my arm into my index finger. I went to the doctor. They prescribed me some steroids, which had no impact on the pain level, or there was really no improvement after that. So I came to Jason here, and he initially did the x-ray, saw some degeneration, attempted to do an adjustment, but then, because of the level of pain I was enduring, recommended I go get an MRI. So I did the MRI, and my primary care doctor said I should go see a surgeon. That was the recommendation that I received. So I started doing some traction decompression here before I had the opportunity to go to the neurosurgeon who specializes in neck and back surgery. And when I went to the neurosurgeon, he told me that 70% of these types of things resolve themselves, which was kind of a surprise to me after being in such pain for several months at that point. So I asked him about the traction table because with my diagnosis, they instructed me that, or they told me that the disc was actually pressing on my spinal cord, which to me was pretty scary. So I asked him about the traction table, and the neurosurgeon actually told me that he was a big fan of that idea. Surgery should be, according to him, a last resort. So after about 3 weeks of doing the traction table, I got the feeling back in my finger, and quite frankly, the pain has subsided, which I'm getting emotional about because it was such misery. The pain was so miserable, and it was constant. Couldn't lay down, couldn't stand up. I have 4 little kids, so that type of turnaround in such a short amount of time without having to go through surgeries, it was quite the relief. So it's really had an impact on my life.
And it's huge how pain can not just affect your quality of life, but can affect the lives of the others who are close to you, which is one of our greatest goals, is to help patients and their loved ones to be able to live life. We're getting through the acute phase of the disc bulge, which we can actually see here on. So this is Kevin's x-ray that I took of him here in my office. And looking at his x-ray, we can see a significant structural problem, which is the reason the disc bulge happened in the first place. So the structural issue puts too much load on the disc, and the disc, think of it like a jelly donut, which causes it to bulge out. So getting that disc, and here's the MRI, we can actually see that the bulge is pressing on the spinal cord. And I have to say that I'm very surprised, pleasantly so, at the surgeon not recommending surgery. Just from me looking at his x-ray, I've seen many MRIs that patients have brought to me that didn't look quite this severe, that patients have had surgery. And there's always a time and a place for a surgery, but you can never take it back. So it should always be a last resort, just as the surgeon said. So now that we're taking the pressure, what decompression does, it separates the vertebra, taking the pressure off of the disc, which allows that disc material to go back inside. And once that heals, the next step is going to be to address one of the reasons it happened, which is the abnormal structure putting that compressive load onto the disc. So amazing testimony, huge transformation. We're so glad to be a part of Kevin's life so that he can live a better quality of life for himself and for his family. And we look forward to just continuing to help him from here on out.